Assalamu alaikum. You are watching MLT MCQs. I am Kamran. Today the topic of our MCQs is microcytic hypochromic anemia, and we will talk about 12 best MCQs in microcytic hypochromic anemia. So let's start the MCQs. So our MCQ number 1 is the osmotic fragility test result in a patient with thalassemia major would most likely be. Options are increased, decreased, normal or abnormal, and the true option for this MCQ is option number 2, decreased. The osmotic fragility test result in a patient with thalassemia major would most likely be decreased in thalassemia major patients. MCQ number 2 is all of the following are characteristics findings in a patient with iron deficiency anemia except. Options are microcytic hypochromic red cell morphology, decreased serum iron and ferritin level, decreased total iron binding capacity TIBC, increased RBC protoporphyrin, and the right option for this MCQ is option number 3, decreased total iron binding capacity TIBC. MCQ number 3 is iron deficiency anemia may be distinguished from anemia of chronic infection by. Options are serum iron level test, red cell morphology, red cell indices, or through total iron binding capacity test. The right option for this MCQ is option number 4, total iron binding capacity. So the iron deficiency anemia may be distinguished from anemia of chronic infection by total iron binding capacity. MCQ number 4 is which anemia has red cell morphology similar to that seen in iron deficiency anemia? Which anemia has red cell morphology similar to that seen in iron deficiency anemia? Options are sickle cell anemia, thalassemia syndrome, pernicious anemia, or hereditary spherocytosis. And the right answer for this MCQ is option number 2, thalassemia syndrome. In this, the red cell morphology will be similar to that seen in iron deficiency anemia. MCQ number 5 is iron deficiency anemia is characterized by. Iron deficiency anemia is characterized by. Options are decreased plasma iron, decreased percent saturation, increased total iron binding capacity, or decreased plasma iron, decreased plasma ferritin, or normal RBC porphyrin, decreased plasma iron, decreased percent saturation, decreased TIBC, or through decreased plasma iron, increased percent saturation, and decreased TIBC. And the right option for this MCQ is option number 1. Iron deficiency anemia is characterized by decreased plasma iron, decreased plasma saturation, increased total iron binding capacity test. MCQ number 6 is storage iron is usually best determined by. Options are serum transferrin levels, hemoglobin values, myoglobin values, or through serum ferritin levels. And the right answer for this MCQ is option number 4. Storage iron is usually best determined by serum ferritin levels. MCQ number 7 is all of the following are associated with sideroblastic anemia except. All of the following are associated with sideroblastic anemia except. Options are increased serum iron, ringed sideroblast, dimorphic blood picture, increased RBC protoporphyrin. And the right answer for this MCQ is option number 4, increased RBC protoporphyrin. All of the following are associated with sideroblastic anemia except increased RBC protoporphyrin. MCQ number 8 is, what is the basic hematological defect seen in patients with thalassemia major? What is the basic hematological defect seen in patients with thalassemia major? Options are DNA synthetic defect, hemoglobin structure, beta chain synthesis, hemoglobin phosphorylation. And the right answer for this MCQ is option number 3, beta chain synthesis. MCQ number 9 is, which of the following is the primary hemoglobin in patients with thalassemia major? Which of the following is the primary hemoglobin in patients with thalassemia major? The options are hemoglobin D, hemoglobin A, hemoglobin C, or hemoglobin F. And the right answer for this MCQ is option number 4, hemoglobin F. This is the primary hemoglobin in patients with thalassemia major. MCQ number 10 is, a patient has an hematocrit HCT or packed cell volume of 30%, a hemoglobin of 8 gram per deciliter, and an RBC count of 4 multiplied by 10 raised to power 12 per liter. What is the morphological classification of this anemia in which the hematocrit is 30%, the hemoglobin level is 8 gram per deciliter, and RBC count is 4 multiplied by 10 raised to power 12 per liter? The options are normocytic normochromic, macrocytic hypochromic, microcytic hypochromic, or normocytic hyperchromic. And the right answer for this MCQ is option number 3, microcytic hypochromic. Last MCQ is, in which of the following condition is hemoglobin A2 elevated? In which of the following conditions is hemoglobin A2 elevated? Options are hemoglobin H, hemoglobin SC disease, beta thalassemia minor, or hemoglobin trait. And the right answer for this MCQ is option number 3, beta thalassemia minor. Thank you so much, dear students, for watching MLT MCQs. Please subscribe our channel and share this video with your friends. Take good care of yourself. Allah Hafiz.